Soft tissue release for the Quadratus Lumborum. So going to start here with some transverse work. So client and side lying, locking into that tissue in the lumbar area and getting the client to simply roll back into your hand. So locking away from the spine and rolling back. So a lovely way to warm up the whole of the thoracolumbar fascia, or the whole of that lumbar area. So this is transverse STR to the QL and the erector spinae in this position. And then as the tissue softens, we can get a little deeper between lower ribs and hip into the QL. Lock and client rolls. Beautiful. Once that tissue's warmed up, let's move on to longitudinal stretching. So I'm just going to get my client to place their hand on their head, but nice and relaxed here. I'm going to then lock into that QL tissue and pull it towards the hip, and then cue the client to pull the ribs away by reaching with their elbow. So again, locking into the tissue, pulling it back towards the hip, and client reaches away with the elbow. So really nice. So some people, the gap between rib and hips is small, so assisted fingers is enough in there. And if it's a wider area, you can also try other applicators. Or even if the client's quite tender, a soft elbow or forearm is nice. And again, we can do transverse from this side, lock down towards hip to protect the rib, and then simply ask your client, once you've locked, to roll away from your elbow. Lock down and towards hip, and client roll away.